This video is for checking IV site and IV therapy. So to begin this video, I'm going to check for the order, the appropriateness of the therapy and the meds. I'll be checking the any inconsistencies that I may have seen. I'll be looking at any allergies to the medications, as well as any allergies or reactions to the therapy itself. I will be looking for any previous reactions, how well they have tolerated it, the flow, the findings, the expirations on the medications, or the bag that's hanging, if there was any leaking color changes, odors, anything that was notable before. I'll be looking for the purpose of not only the medications but the IV therapy and making sure that both of those are appropriate. And then I will be doing hourly checks, and I will also check on the site and the IV per medication administration, and more per facility policy. So now that I've done all that and I've checked all the orders for that, I'm going to do hand hygiene. I'm going to knock on the door, and then, hi, my name is Desi. I'm your nurse today. So I will be checking your IV site, but before we begin, can I get your name?
At 9, yes.
And your date of birth?
Tuesday.
Okay,
yes.
Thank you. So I'm checking that with not only what's on the bag, what's on the wristband, but also with the computer. So now I'm going to perform hand hygiene, and then so I'm going to be in here for about 15 minutes or so, maybe less. I'm just going to give you a once-over, a look-over, and make sure that everything is running smoothly, okay? Do you have any questions at this time? No? Okay, at this time I'd raise the bed to an appropriate level for me, and then lower the bed rail on the side of the arm so I can get a good look at it. So then once I'm in here, I'm going to take a look at everything. I'm going to just put on some gloves and take a look at everything. So I'm just going to be I'm also going to be trying to educate my patient the entire time about what I'm looking for so that they can notify their nurse with anything that they notice. All right. So I'm looking at the site here, and well, first I'm going to check this. I'm going to look at the bag. I'm going to look for the color, the clarity of it, any leakage, any expiration dates. I'm looking for the drip rate. If if it's just a drip and it's a gravity flow, I'm looking at the drip rate. Looking to make sure all the clamps are open, making sure there's no leakage throughout the tubing. The tubing is patent, looks accurate, and making sure that again, all the all the clamps are open, that the flow is correct, making sure there's proper placement. All right. So then I'm going to be checking the monitor. When I'm looking at the monitor, I'm looking for the fusion rate. I'm looking at if there's any alarms. I'm looking at the flow. I'm checking all that with the computer.
Okay, Julius.
I'm looking at.
Did you say you were large or extra? Okay.
The settings, any settings that are there. Looking at the monitor, making sure that it works properly, that there's no issues, that there hasn't been any issues. So I looked at the bag, I looked at the drip, clamps are open, no leakage. All right, so everything up here looks good. I'm looking at expiration dates of also the tubing itself, making sure that that's appropriate, and then the usage is appropriate for the medication or the therapy that is being provided. Okay, so now I'm going to move on to the site. For the site, I'm looking for any infiltration, any infection, any infiltration, infection, phlebitis, looking for any blood or any pain on palpation. When I palpate, I'm palpating for duration, making sure there's no pain around, that nothing's coming up through the skin. Through the dressing, I'm checking the patency of the dressing, the date, the expiration of the dressing, when it was last done, checking all of that with the computer to make sure that these are being documented appropriately. and that is within the time frame. I'm also looking for coolness, pallor, leakage, warmth, redness, pus, any signs of infection at all, any signs of phlebitis. I'm looking for any any blood or any moisture within the dressing, or if the dressing is peeling off, I'm going to be checking for that, making sure that the dressing is patent. Okay, so that was a check of the IV, the bag, the line, and the dressing. Okay, so what I was looking for, like I said, was just making sure that your dressing looks good. I want to make sure that the dressing stays on. If you notice any moisture or bleeding inside of it, you let us know. If it starts to feel painful, it should not feel painful. So if it starts to feel painful, you just let us know. In the case that I am finding any of the symptoms that I did say, like inflammation, phlebitis, infiltration, blood, pain, we would hold the therapy if appropriate and contact the primary care physician, get new orders, remove and put on a new site. Just depends on what the issue is and what the physician orders. Okay, so now that we've done that, we are going to listen to the lungs and the heart. We're listening to make sure that there's no tachycardia, that there's no fluid overload. We don't want any hypertension. We're going to get a set of vitals. And this is all to make sure, no fluid retention, no fluid overload, because we are putting stuff into the patient. So we're going to go ahead and do that. So I'm going to listen to the heart, lungs. Sit up for me, if they can. Okay. All right, and so it sounds good. Are you feeling any fevers or chills? No? Are you feeling like your heart racing? Anything you want to talk about? No? Okay, so they're not feeling any fevers and chills. I'm looking for signs of infection, signs of not allergic reactions or adverse reactions to the therapy or the medications. All right, so if you need me, or if you start to feel uncomfortable, pain, anything like that, are you in any pain right now? Can you rate that for me? So there's no pain noted at this time. If you do start to feel pain, discomfort, you see any of the things that I was looking for that I mentioned earlier, if your bag is about to run out, or if you hear the alarm sounds on your machine, just give us a call and we'll come in and we'll help out with that. We'll get that fixed right away, okay? If, like I said, if you're feeling any type of way, fevers, chills, anything that's not normal for you, or you feel pressure on your chest, you come and let us know, or push your light and let us know, and then we will be in here to help you and regulate that, okay? All right. So now I'm going to go ahead and take off my gloves. Do you have any questions for me? No? Okay. All right. Perform hand hygiene. All right. I'm going to lower the bed and lower the head, making sure that it is appropriate height for the IV therapy, especially if it is gravity flow. And be sure to come back and check per hour, per facility policy, and per medication administration. Thank you. So this is the blood administration video. So per my last video, you saw me go ahead and check the IV. The saline was being used, so it's already infiltrated throughout the system. I checked the site for patency. I've already asked about fever, chills, warmth, redness, pus, phlebitis. I've asked about pain. I've asked about all those things in my previous video. I've checked the date of both the infusion set and the bag and all of that. I've already verified who we are, provided privacy, gathered my supplies and put them on the bedside table. I've already done hand hygiene. Probably will do it again. But so we are going to just start by jumping right in. I've already verified any medications, making sure that they were given 30 minutes prior to my blood administration. I've already identified who my patient is. We've already done all that, so we're going to go ahead and I'm going to provide hand hygiene. Okay, so now I'm just going to, already done that. Alright, so I'm going to explain the blood procedure. So we will be doing, I'm going to put this down so I can talk to you a little better. I've already raised the bed up, I've already had him sit up so we can communicate better. I've already verified any needs, any previous reactions or allergies that have been had. So we're going to be doing a blood transfusion because you've had a GI bleed and you've lost some blood. So we just want to make sure that you remain healthy, so we will be infusing some blood into you, okay? So that'll be the process that we are performing right now. Do you have any questions? No? Okay. So then we are going to go ahead and already assemble. All right. So I'm going to go ahead and call in my second nurse. I'm going to go ahead and make sure that she's in here while I've explained the procedure. She's explained the procedure. She's verified consent, that the orders are correct, the medications are correct. She's verified any allergies that have been had. She's checked for the site. She's checked the IV. She's done all that as well. Making sure consent, that there's a reason for the therapy, that we've verified that the therapy is needed, the orders, the blood type. She knows my patient just as well as I do at this time. So I let her do all that. So now we're just going to go ahead and call the blood bank. So the blood bank comes, they bring us the blood. I verified the expiration date on the blood. We've verified expiration. Saline is still running. We verified expiration. We verified there's no clots, no clumps, no formations. We verified that the color and consistency is where it needs to be, that the type is AB, RH positive, that it is correct to everything that we have. We've scanned the bracelet, the bag, the saline, the sites, anything we need to scan, any medications that needed to be scanned were already scanned and verified and scanned into the computer that we are using. So we're going to go ahead and, alright, so we've done all that. Alright, so we both verified all this with the blood. Any numbers that need to be peeled off the back have been put on the proper placements. If we are having any issues such as fever, rash, chills, any allergic reactions, any reactions period that are not consistent with what we need, we're going to go ahead and call the PCP, the primary care physician, and we're also going to call the blood bank. And then we would stop the transfusion immediately. We would tear it all down, put it in a proper waste receptacle so that the blood bank can verify the reasoning for the reaction. The primary care physician can verify if it's the blood or if it's the patient or what we need to do next and provide orders for that. In the meantime, I would put up a whole new line, whole new saline, and try to flush out the reaction that we did have. Okay, so like I said, we're having no reactions. We're good so far. We're going to play like there is no reactions today, but that's what I would do if there were. So this is all good. Alright, to spike the bag, once I need to spike the bag, I'm going to remove the cap from the bag, I'm going to remove the cap from the tubing, and I'm going to make sure they immediately go into each other in a push and twist motion, verifying that they don't touch anything else. For this verification, for this video, I am just going to use the tape. So we've taped it together, we've done it, I've hung it. If this was a drip by gravity, I'd be counting the drips. I would have, before I stabbed my bag and hung it up, I would have closed off the clamp to the saline and then to the clamp that's below the drip device or the machine. And then I would have made sure that all the other subsequent clamps have been closed. Then I would have spiked the bag, hung it. Okay. So now that my bag has been hung, and it is looking good, I've checked the expiration, it's not leaking anywhere, the tubing's not leaking, the tubing is within its expiration date as well, because I just hung it. Like I said, the saline was running, I would have stopped that and clamped everything up. just prior to spiking my blood bag. I'm going to go ahead and open the clamp for my blood and saturate the tubing. If I'm doing by gravity, I'm just going to count the drops to verify that the gravity flow is at the right rate. And then, if not, I'm still going to saturate the filter in here, put it into my machine. I'm going to start my machine at 2 milliliters per hour for the first 15 minutes, and then I would speed it up after that per physician orders. I want to make sure that there's no reactions for the first 15 minutes. I would take vitals at 5, 10, and 15 minutes, and I would be in the room in the entire time for the first 15 minutes to verify that there are no reactions happening. But after that, I'm going to go ahead and put my alarm. I'm going to go ahead and set it for the recommended time per my order. And then I'm going to come back often and take vitals, check the site, check for rash, check if my patient is having any of these symptoms listed prior, any fever, chills, redness, itching, rash, any infiltration, phlebitis issues, any infection issues, that the dressing's correct, all the things that I did within that first video. I'm just going to verify that there's no pain. I'm going to be talking, making sure there's no unusual or odd feelings that they may have. Also, prior to even spiking my bag or clamping or anything like that, I would have put on gloves. I did not. I would have made sure that there were the gloves on before touching any of that. Whoops. Okay, so we're going to go ahead and flow. We're flowing. I'm checking often, coming back, checking for all the symptoms. Once the bag is done, I'm going to verify the vitals at the end as well. Get a inset vitals, compare it to my baseline vitals, compare it to the vitals previously had, make sure that there is no inconsistencies. I'm going to take my bag down, take the infusion set down, the entire set with the blood in it, and remove it, scrub the hub, clean everything off, scrub the hub of my venous access site, the outside of that where it was connected, make sure it's getting all flushed. As I change the site and hang a bag of saline, connect that with new tubing all on into it, make sure that that's flowing correctly. Of course, doing my checks again, and then disposing of this in the proper waste receptacle per facility policy. Okay, so now I'm going to deglove and perform hand hygiene. Alright, I've already done my vitals. I've looked at and asked about any redness, swelling, painfulness, itchiness, rash. There was none. Okay, I'm going to go ahead and raise this back up. And I'm going to bring you back down, okay? To a safe level. Alright, perform hand hygiene, and then I'm going to go ahead and properly document what I need to document. How the reaction was set, make sure that there was no reactions. If there was, I document how I handled it, what happened, exactly what the reaction was, how much I've infused, making sure that my infusion was within the 4-hour time frame, including the 15-minute at 2 milliliter per hour. From the minute I got the blood to the minute it was finished, making sure that all that time frame is within the 4 hours that the blood is viable. I'm going to document, of course, how much I've used, what type I used, the blood, timing, all that, any medications that were needed or used. Okay, making sure that my room is safe and clean, and then I'm going to go ahead and leave, of course, document, and thank you for watching. I would have put on PPE if indicated. I would have explained fluid overload was for cardiac and respiratory failure. I'd have done input and output measurement, edema, shortness of breath, and then I would have gloved prior to touching the blood. And I also would have done baseline vitals and vitals after the procedure.